Hello, and thank you for joining us for this spotlight session on cancer care presented by the Indian Cancer Society and supported by Roche. I'm your host, Anisha Nayar Dhawan. In this spotlight session, we'll talk about cancer awareness and newer methods to detect cancer. For the third year running, IHW Council is proud to present the Cancer Summit, where we bring together expert oncologists, drug developers, NGOs, caregivers, and cancer warriors to brainstorm on strategies to increase awareness about this disease. Now, our IHW Council is happy to partner with Indian Cancer Society, a not-for-profit organization that believes together we can rise against cancer. ICS was started in Mumbai by the famous oncologist Dr. Jusawala and Naval Tata in 1951. ICS believes that the biggest effort should be in cancer prevention activities, especially for the poorer sections of the society. ICS spreads the message in a non-threatening way so that cancer is treatable and curable if detected early. ICS is reaching thousands of underprivileged people in both rural and urban Karnataka with free awareness and screening camps for early detection of oral, breast, and cervical cancer. ICS supports initial treatment through the Bridge Fund and supports emotional counseling and supplies free wigs and prosthesis for those in the rehabilitation stage. IHW Council has been at the forefront of advocacy for cancer awareness, as knowledge and early detection is the best defense against this disease, whose burden in India is projected to grow to 1.57 million by 2025. The COVID pandemic, which has been raging for the last 2 years, has not only had a profound impact on cancer treatment, but also screenings, which help detect some cancers early. This is particularly troublesome in India, where nearly 70% of cancer patients come to doctors at the terminal stage. The effects of the pandemic apart, there are other economic and sociological reasons for that hinder early diagnosis of cancer in our country. So how can cancer be detected early in India? What kind of innovations are underway in cancer diagnosis, which are perhaps easier to execute, cost-effective, and more accessible? To discuss this and more, we have a panel of experts. Please welcome Dr. Srinivas BJ, Consultant Medical Oncologist, HCG, Dr. Roshni Dasgupta, Consultant Medical Oncologist, HCG, Dr. Sai Vivek, Consultant Medical Oncologist, Sri Shankara Cancer Hospital and Research Center, Dr. Vishal Kulkarni, Consultant Medical Oncologist, HCG, NMR Curie Center of Oncology, Hubli, Dr. Mohammed Naseer, Consultant Medical Oncologist, HCG, Ms. Savita Shekhawat, breast cancer survivor, and Ms. Meera Naimpally, a lung cancer survivor, who are joining us on this show to discuss about cancer, its awareness, and the importance of early detection. So thank you all for joining us, and it's a real pleasure to have so many voices with us. So I'm going to pose a first question to the doctors in the house, and I would request Dr. Sai Vivek to take this question. Now, do you think that over the last few years, there is more awareness about cancer among people, not just in urban areas, but in rural areas, and maybe more so during the pandemic, because there has been an information deluge, and people are getting a lot of information on their digital handsets?
Definitely, Anisha, yes. But with every passing year, I think there is increasing awareness about different cancers that is being given to the public. And with COVID pandemic, families used to stay together, and there were a lot of discussions about multitude of topics. And one amongst them might have been about many cancers that either of the family members might have gone through, sharing of experiences. So in this way, yes, there would have been more awareness. But again, mass screening programs, as you have mentioned, have taken a backseat. And that is going to hurt us more than anything else in the long run.
All right. So I would like to understand what has been the experience of doctors. Dr. Srinivas BJ, have you seen that during the pandemic, perhaps patients have put off testing, screening for cancer, and this has cost them? anecdotally, we've heard a few oncologists tell us that now a lot more people have come in advanced stages of the disease. Is this something that you've seen in your practice?
Yeah, definitely. Thanks for this invitation and this session. Definitely, especially in the first wave and second wave, definitely we have seen that the patient and patient relatives are, hesitating to come to the hospital, and we have seen that the cancers which have already controlled by our treatment, which has come back aggressively when they come for the second testing. So screening program as such, they are not much available, but definitely as the cancer testing itself has taken a backseat, so definitely the screening also has taken backseat, and definitely we have seen increase in the disease, and the cancer has progressed over a period of time during the last 2 years.
All right. We also have two cancer warriors with us, and I want to understand from them what role did awareness play in their journey? So Savita ma'am, let me start with you. Now, you're a cancer survivor, and you have survived breast cancer. Did you know about breast cancer, what to look out for? Were you aware of what it really meant?
Thank you for this invitation, and I'm sure this is really going to help other patients and caregivers. For me, yes, I was aware of breast cancer symptoms, and I planned that I would be doing my regular mammograms and other checkups. But at the same time, I never thought that I would be diagnosed at such an early stage. So I was diagnosed at 36, and when I went to my physician, I was told there is nothing which is suspicious. But at the same time, since I was aware that these are the symptoms to look for, I myself self-examined, and then I took an appointment with the oncologist. And then it came up like a shock for me that it was third stage of breast cancer.
Third stage.
Yeah.
So you felt a mass in your chest.
Not exactly. I didn't feel, I was not in habit of, I was not in routine of self-examining myself, which I advocate now that every woman, after the age, I think as early as if she can start up to 20s or so, they should do regular self-breast examine, because I feel if I had been in habit of doing so, I could have caught it at a much earlier stage. But for me, the symptom was some discharge from my breast. And at that point of time, I was told that it might be some hormonal imbalance. But since I was aware that in many cases it may go undiagnosed, so I self-examined myself, and I felt there could be a mass, which I was not sure. So I felt better to rule it out and meet the oncologist. And I think that decision saved my life.
That's amazing. That's amazing. You were self-aware and you were assertive that you didn't let anybody dismiss your, worries about yourself as oversensitive, over panicking. This happens a lot with women, आपको हर चीज बहुत ज्यादा लगती है, हर चीज से पैनिक करते हो और सब डिसमिस कर देते हैं, ये क्या बात कर रहे हैं?
And not even that, जो radiologist मेरे ultrasound कर रहे थे, she was also at one point was laughing and was brushing it off कि आप इतनी छोटी चीज को लेके क्यों आए हो? And I was like happy कि अगर छोटी चीज है तो I'm very happy, but unfortunately that was not the case.
Right. Kudos to you for being so aware and how it has helped you. Meera ma'am, did you ever think that you could get lung cancer? And why I ask this question is because, lung cancer, people think, oh, men smoke, they're the ones who will get it. Why should women get it? What have women done to get it? How have they increased their risk to get lung cancer? Could you tell us what was your journey like? Were you aware of lung cancer and that perhaps, even women in our country are increasingly be diagnosed with lung cancer?
Thank you so much for inviting me. And let me tell you, I was not at all aware of, I just had a cough and cold. And that cough didn't stop for 15 days. Then I went to the doctor. Doctor said it's better to get X-ray done. Then I did the X-ray, and doctor suspected cancer. And he told me on my face, he told me I'm suspecting cancer. So actually, I'm basically I'm very positive lady, very positive lady. So I didn't tell at home at all. My husband is very sensitive. I have two kids. My son was in Saudi. Daughter was she was just 20 years old, and I told her, "Shall we go to the lab and do the scan?" So I didn't tell her why. So we went there, we did the scan and all. Then those people, they called my husband. They took the number, they called my husband, and they said, "It's better you come here, we want to talk to you." So he came, and of course, there was all, he was totally, shattered. And we called, in fact, we have lovely friends with us. So everyone were with me. And then I went to a hospital. So I had a very good treatment. I really thankful to them. I took a treatment for a year. It was in 2012-13, and in between, once it relapsed. Maybe after 1 year, it relapsed. And even at home, what I used to do is I never used to show my fear. Nothing. It's everything was normal. So even I didn't even know that my cancer was post stage. And in fact, I was normal with all my family, and everything was fine. Then doctor, I came to know that I was in the last fourth stage, and at that time I realized, oh, something is going to happen. Then immediately I decided to settle everything. And I told my daughter to get married soon. I got her married at the age of 21.
Ma'am, it's been 10 years and you're with us. And that is testimony to your will to live and the
I'm very positive, ma'am. I'm very positive. Even today, in fact, while going for chemo, I used to talk to everyone there. I used to make them laugh. I'm a very entertainment person. So I used to make them laugh.
I think it's a spirit that has helped you come this far, and we really congratulate you for that. But what I want to point out to our experts here is that we have two sides of the spectrum. One, a patient who was so self-aware that she was like, no, please don't dismiss my fears, check them out. And the other who just had 15 days of cough and was told you have stage 4 cancer. So Dr. Roshni, let me come to you. Now, Savita is an aware person. When it comes to breast cancer, it is the most prevalent cancer in our country, and the mortality rate is also very high. Has awareness about this increased? Are we seeing women coming in with at earlier stage of the disease? Because the data shows us that this is not true. Most women in breast cancer come at advanced stages.
To address this question, I would cite the example that we have in front of us. Savita, she herself having been so aware about it, pursued her symptoms, and she was diagnosed timely regarding her breast cancer. I think the concept of awareness, of being aware of a breast cancer, is percolating in the society. And in these meetings, I always reiterate that there is a difference between the urban and the rural population. Despite being aware, but again, as Savita also said, that most of the women are quite afraid of the diagnosis. So even if they're aware, if they are feeling some breast lump, they have some unilateral nipple discharge, they're like common symptoms related to breast cancer. Even if they're aware of it, they usually tend not to go to an oncologist in the fear that they might get diagnosed with cancer. So it is not only important to make women understand that aware of breast cancer in itself, but also to make them aware that if we can catch it in the early stage, it can be very much treatable and curable. So that is something that is probably missing. So despite people being aware that yes, breast cancer is very common in India, in fact, it is one of the highest cancers diagnosed in India per year. Despite women being aware of breast cancer, the fear to visit an oncologist is much more.
Okay. So Dr. Roshni has spoken about fear. Dr. Sai, there may be a social stigma also attached to breast cancer. Now, what is happening in our country is more and more cancer cases are coming up. Nearly every family has some case of cancer. So it is being spoken about more freely. So awareness is there. But there is a social stigma that some women feel is attached to breast cancer, its involvement of their self-image, their self-worth. And some also feel that, because breast cancer could be hereditary, let's keep quiet about it. I have a daughter to marry. Let's just keep quiet. Maybe it is not that. So how do we communicate so that the message drills down? Are we missing something in our advocacy?
So I think each of the points that you have listed, we, I think, get into it in our day-to-day practice. So all of these happen. So people are scared to even tell their closest relatives or their closest friends. There are people like Ms. Savita, definitely, or Mrs. Meera, who have a good social support and are open about it. But majority of the population still consider it to be a social stigma. Whether it is going to be genetic and it's going to affect their children's marriage or not, that is also one of the most important things. But one thing as doctors, what we have to do is it's not a one-time drilling, I feel. It's during the course of treatment and during follow-up, we have to tell them, see, you're a survivor. You have fought against cancer and you have won against it. It is your responsibility to spread the message that more people will benefit from early detection and cure, possibly. So it is an ongoing process. Just saying it once, I don't think is going to be enough.
All right. And we thank our cancer warriors for coming onto the show and talking about their experiences, because this actually makes it more real, more human, more relatable, and perhaps will really go a very long way in removing the fear of cancer. Dr. Srinivas, we heard Meera ma'am, and she's very positive and she's smiling. But it surprises me that the way lung cancer is increasing in our country, and that she was stage 4 after a 15-day cough. I mean, what is happening in our country when it comes to lung cancer? Not just men who, are through their lifestyle more predisposed to lung cancer. Women, younger people, younger men, younger women are getting diagnosed with lung cancer. Is there a lack of awareness? Is this catching us by surprise? What is happening here?
Yeah, first of all, I want to congratulate both of them, Savita and Meera ma'am. I would like to have patients like this for our treatment, or the patients who can aware of their cancers before they come into the final stage of treatment. Yes, even in the breast cancer, as our colleague has told, there is a gross difference in the urban and rural population. Still, we get most of the patients in the advanced stage of cancer. Nowadays, because of some of the awareness, especially the urban population, we are getting the early stages of cancer. Coming on to the lung cancer, still the patients compared to the Western countries, 30 to almost 70 to 80% of the lung cancers are detected in the final stage. Stage 3 and stage 4 type of cancer. Only, just I was going through the literature, only 3% of the lung cancer, early, cancers in India are operational. Surgery they will do only for the 3% of lung cancer. That means to say, usually early stage of cancer is the only one where we can do the surgery and we can achieve the cure. So that percentage in India is only 3%, whereas in the Western countries it is 30 to 50%. So apart from the smoking, so other causes is especially the non-smoking, especially the women who doesn't smoke. So there are so many causes highlighted. So one among being the air pollution or indoor pollution, like exposure to radons, because so many other from the other materials, and some occupational exposures, or the endogenous risk factors, like some of the studies they're telling this genetic polymorphism itself, the enzymes or the hormonal metabolism or catabolism is altered in some of the persons, and they are more prone for risk of of lung cancer, or some of the patients estrogens in women also may be at the risk of getting the lung cancer. And more importantly, the passive smoking. So passive smoking is also one of the reasons. Even the person doesn't smoke, if they are in and around the smoking persons, definitely their lung cancer incidence or the lung diseases will increase in those persons. And especially we have seen some of the women, especially the rural women, where the husband is smoking, and the wife comes with a history of the lung cancer, symptoms of lung cancer. So these are the lung cancer. These are the reasons apart from the smoking where we can get lung cancers in non-smoker population.
Right. Dr. Vishal, Dr. Srinivasan has contrasted lung cancer incidence in early stage and late stage in West versus India. Now, what could be the reason for this? Okay, our country is developing, perhaps we have more pollution. But smoking and these lifestyle things are common in the West and here. So he also spoke about studies about genetic makeup. Whatever be the reason, could there be a way where increase awareness or screening could catch lung cancer early? Because like breast cancer, lung cancer is also one of the screenable cancers, but only for those who are high risk. And what is happening now is that even not high risk people are coming up with advanced stages of lung cancer.
Good evening, everyone. Thank you for arranging this meeting. It will definitely be one of the points in awareness, creating awareness for the patients, and especially when we have cancer survivors, it becomes much more easy to, it sort of gives more legitimacy to what we say. So coming to the question that as Srinivas sir was rightly pointing out, the causes are very heterogeneous in Indian population, and also what happens is the symptoms actually mimic a lot of other common diseases of respiratory system, like COPD or an asthma or a tuberculosis. So these are the things where the patients don't really consult the doctors for the treatment, especially in tier 2 cities where I practice, and tier 3 cities and villages where the physicians are not aware that the symptoms, if they are not controlled in 1 or 2 months, can be a cancer. But they keep on treating them with tuberculosis or asthmatic drugs or steroids. So basically what happens is the high index of suspicion that needs to be there is absent, especially even among the physicians, I'm telling, even among the physician community. So probably because they see 1 cancer out of 10 of their patients. So probably that's how it is. And so what I think what we can do is we can educate people and create more awareness, conduct training camps, even for physicians, even for local general practitioners.
So, Dr. Vishal, for lung cancer awareness, do you think we need greater awareness campaigns with general practitioners, with family doctors, rather than the end person who gets it? Because, you have a cough, it could be anything. But when you go to the doctor should guide you to the right person. Meera ma'am was very lucky. Her doctor told her first on, I suspect it's cancer, please get it tested. She was, of course, stage 4. Now, somebody is in early stage of cancer and coughing. TB is widespread in our country. Nearly everybody has it. If not TB, they have the DNA at least. So, where do you need to be directed in the right direction? For that, perhaps we need more awareness amongst physicians than just the people.
I agree with that. And also what happens with the TB is that it kind of confounds the screening modalities also. Like suppose you take a low dose CT and then there are a lot of features that mimic a TB, even though there are cancers. So all these things matter. So a physician may not be that keen on pursuing a diagnosis of cancer in these patients. So he may be thinking still it may be TB. So, and some of the lung cancer spread so rapidly that by 3-4 months, they are actually in the advanced stage from the early stages. So I feel there should be more awareness. There should be more government initiatives And some of the things are actually unexplainable. Like probably a legislature to ban diesel vehicles would help, like probably a push from everyone to for the government to ban diesel vehicles, to ban biofuels. Like if you go to villages, they actually, what they do is they actually dry the cow dungs and then they use it.
They burn it. So the government is taking initiatives there by giving gas cylinders to the poor. We are having EVs, and that effort is underway. But perhaps awareness amongst physicians, perhaps we investigate both tracks, investigate option of TB and cancer at the same time. Is that not possible? I would say
both ways, awareness at both levels, awareness at doctor's level, at physician level, including the general practitioner, and awareness at the patient level. Both should go hand in hand. Yeah.
Okay. Dr. Naseer has been listening very patiently to all that is being discussed. Now, Dr. Naseer, today we are discussing these two cancers, breast cancer and lung cancer. Both of them are considered screenable cancers. And both of these have high-risk candidates, especially those in breast cancer who have a family history. So they are considered high risk, and then they are suggested, get regular mammograms done so that if something's wrong or if you have cancer, detect it early. For lung cancer, high-risk patients, cigarette packers are calculated and then said, okay, you go for a low-dose HRCT so that we can try to catch lung cancer early. But these are not exactly working in our country because of infrastructure, or the whole debate about who's high risk, and it's even going to the low risk people. Kis ko kare, कौन जाएगा ये HRCT? कोविड के टाइम में तो सबने ले लिया, पर हर साल करते रहेंगे क्या हम? What research is underway so that through genomic profiling we can perhaps detect cancer early? I'm talking about comprehensive genomic profiling.
That's a very interesting topic, comprehensive genomic profiling. It means that with a single go, you are finding out a lot of genes, like more than 100 genes, you are checking them out and finding is there any abnormality in that gene which has led to the cancer. A lot of patients ask me, like, what was the reason for the development of cancer? Even in screening and in patients, they ask me what is the reason for development of cancer. Most of the answer lies in this, the comprehensive genomic profiling. The genetic makeup is disturbed, and that is the reason where the cancer starts developing. So we have a lot of data that if you find out one particular genetic mutation in any cancer, consider breast or lung cancer, and we target those mutations, the response to treatment is significantly better than the response to conventional therapy. So there's a lot of metamorphosis in the treatment of cancer. It is not just earlier how it was, just go do surgery followed by chemotherapy. It is more of precision medicine now. Precision medicine means that each person has a different genetic makeup and different gene which is involved, and if we find that gene and target that gene, that will definitely help to get us very good results. For example, in case of lung cancer, what we see is that in stage 4 diseases, there are certain mutations called as driver mutations. These, by self-explanatory, saying that that is responsible for development of cancer. So we have many particular targetable effective drugs which act on those driver mutations and bring about resolution of the cancer.
So, Dr. Naseer, I'm trying to understand, is this new technology of genomic profiling helping in the treatment of cancer? Is it helping diagnose cancer earlier? Because we don't want to jump the gun. We don't want to scare everyone. We want to say, yes, cancer, if detected early, can be 100% cured. But if the whole country is getting this genomic profile done, just because my gene is not functioning properly, does it mean I will 100% get that cancer? Are we going to increase fear in our country? And is this something which is accessible, cost effective, and scalable in our country?
The answers to the questions are like, comprehensive genomic profiling definitely is for the better management of the patient. I can say that. Once you come for the diagnosis and then you find particular gene and then you treat accordingly. Rather than the screening modality, I don't think so it will be that effective. But consider high-risk patients, like you said, risk of family history of breast cancer or history of lung cancer, significant smoking. In those individuals, high-risk individuals, definitely it will be helpful. But one of the drawbacks of this is that the comprehensive genomic panel, it probably comes at a certain cost, And that if that can be incorporated with the help of the government schemes, then we can go about a better management of the patient. So this genomic profiling, it tells about the complete genetic makeup of the individual, and finding on one particular gene or any abnormal gene will be definitely helpful.
Right. I want to come back to our cancer warriors. Savita ma'am, you've heard our esteemed doctors speak about, what ails early diagnosis in our country. Now, having gone through your diagnosis, your treatment, what would you like to tell people who are watching this show? I may have no risk of cancer, but does it mean that I should just sit pretty?
So this is very true that, we all tend to think that cancer
It can't
is not,
happen to me.
Yeah.
I have not done anything wrong. मैं तो रोज माता के चरण छूती हूँ, मुझे क्यों होगा?
Yes, that is also the case, because when I was diagnosed, I faced this thing myself, कि अरे तुम तो इतना अच्छा करते हो सबके लिए, फिर भगवान ने तुमको ये परेशानी क्यों दी, and that pity on the face, and apart from that, कि you were following very healthy lifestyle, then how come you got the cancer, right? So healthy lifestyle, yes, that's very true. Even just after my surgery, I was lying on the bed and was thinking, what was the use of following all that healthy lifestyle when still I got this cancer? So that is very true, that we tend to think कि हमें थोड़ी ना ये बीमारी तो शायद दूसरों को ही होती है, हमें क्यों होगी? We have this thing, but so when it happens, I think the first thing which we can do is it's not just being aware, but yes, take the step and rule it out, because acceptance ki haan ho bhi sakta hai, just be prepared for the worst case, because we don't want to regret it later on ki if we had gone to the doctor at that point of time, probably we could have at an early stage or इतना advanced stage नहीं होता. So acceptance होना और prepare for worst doesn't mean to create a panic कि oh cancer हो गया cancer. No need to get panic. Rather think कि जल्दी पता चल गया तो we can be completely cured. So
yes,
yeah,
right. Meera ma'am, in our country, we're seeing educated people, like companies have executive checks for all employees, men and women. Most of the time, cancer screening is not part of this. But women and men are going for annual screenings. They are somehow more aware of their health and more willing to take action. So do you think that there is a way that we can take our health in our own hands and we can be more proactive for cancer, detecting cancer early? Because, breast cancer is something, a self-breast exam women can do on their own. And whenever you go visit your gynecologist, which women will do, they have children, they have many issues to go to the gynecologist, they can request them for to teach them how to do a self-exam. But there are many other cancers where, we don't know. We don't realize when until it's very late. So how important is being self-aware and proactive to, reduce the risk of getting cancer and presenting to the doctor in late stage?
In late stage?
Yeah. I mean, how important is to be self-aware and go ahead and take action for your health? May not be just cancer screening, annual screening, companies are doing it. And if they don't cover your cancer screening, perhaps you should do it yourself.
Yeah, that is that. You should do the screening. That is one thing. But the other thing is like, I don't know how to explain it actually. For me, in my case, when the doctor told me that it might be cancer, so for a minute, I just thought, why me? Why me? I've done so much. I'm doing so much. I'm so active. I do a lot of things for the family. I struggle for the family. Why me? So what I feel is the lung cancer. One of the reasons for cancer is stress. Stress and pollution. That is the main reason. So I request everyone to be, should be positive like me. Just forget everything. Life is very short. Life is very short. Enjoy your life till the end. Don't keep on scribbling about the sickness. Oh, I'm not well, I have this, I have that problem. Nothing. Just enjoy your life. That's it. So
that's a very important message, that enjoying your life and reducing
be
your
positive,
stress.
be positive. Don't ever
Reducing
think
stress.
about it. See, from all
Definitely.
these 10 years, only so many people, they call me on the, they call me to take some counseling from me. And they will be so happy. I crack jokes with them. I talk to them so nicely. They feel so nice. Meera madam, we are very happy to talk to you. So that is how the life. So, and
yes, your mental framework is, I think, very important. And I'm sure even counseling during your treatment is very important.
Yes.
And, even the patient support groups play a very important role in how all patients recover. And if somebody like you is there to egg patients on and encourage them, I'm sure they'll recover quickly. Your spirit is really contagious. And thank you so much for joining us. Dr. Roshni, now, what could be practical ways to increase screenings for breast cancer in our country? Now, in the West, annual mammograms are the practice, but they will perhaps start at 45, 50 because their older population has breast cancer. In our country, it's completely different. Women from 35 years onwards or even younger start having breast cancer. And, when at young stage of breasts are dense and mammograms don't necessarily work. So what can we do in India? Our cases, our situation is different. Our demographic is different. But the public health burden of coming with breast cancer in late stage is too much at the size of our population. So what are practical ways to have screening for breast cancer, in your opinion?
When we talk about screening, we always have to give importance to its cost effectiveness. Like screening, along with screening, not only, yes, there are benefits of diagnosing a cancer early, but along with it comes some drawbacks like overdiagnosis. It comes with anxiety if something is detected. So mass screening, I have to see in which population this screening is going to be cost effective. In which population there will be a significant relative risk reduction from breast cancer mortality. So unfortunately, the Indian data is very limited. As you say, it's very different from that of the Western population. That breast cancer in India, women get at an earlier age, whereas the median age in Western countries is somewhere between 50 to 60. It's much lesser in India. So we generally follow the guidelines which have been projected from data, Western data. That is one place where, as a scientific community, we are lacking. Generally, we recommend biannual mammogram beyond the age of 40 because below the age of 40, when breasts are too dense to get mammogram, they are less sensitive. Hence, in case of suspicions, or in high-risk population, we suggest to do USG. Apart from screening using modalities like mammogram and USG, when we talk about breast self-examination, Savita, something is very well aware about now. It has been shown that clinical breast examination or breast self-examination actually doesn't decrease the relative risk of breast cancer mortality. It is only about making women aware. So what is the next step? It should be in our country, because a mammogram or USG cannot percolate to all the strata of our society. We should make people, women, more and more aware of self-breast examination and clinical breast examination. And the next population that we should target is physicians. Like when a woman approaches a physician, a gynecologist, a very common person a woman always sees sometime or the other in their lifetime, they should be aware that how a breast cancer can present with. And that is where the chain of reference should occur to an oncologist or to a higher center where a USG, mammogram, or MRI can be done.
All right. Dr. Sai, awareness about self-breast examination is important, and your gynecologist can help you there. And I think all women should speak up for themselves and say, please show me how it's done. It's going to be for their good. Now, what do you think will work as a good screening system in our country? given that in rural areas for older women, there may be, complete lack of awareness. When should we start talking about it? Should we start talking about this with schoolgirls itself? And what works in your experience? What works as a good screener? Because Dr. Roshni is saying even a CBE or a breast self-exam does not reduce the mortality in breast cancer. How so? If you catch it early, now you should live longer. So, because in our country, the mortality rate from breast cancer is fairly high. What can we do to catch it early and reduce the mortality?
I think awareness programs like this, and I think even going really hard in the population in the urban centers would percolate slowly into the rural areas. As we have seen, most of the people in the rural areas and most of the villages, half the population, their kids would be working somewhere in the city or going abroad. Or that shift is happening from the rural to the urban centers compared to 2 decades back. So self-breast examination and sonomammograms or mammograms post the age of 35 to 40 should be more and more emphasized wherever we get a chance. And that information would slowly percolate into the rural centers, and conduction of camps, multiple camps. So different regional cancer centers can take up the responsibilities of dividing the rural population into zones and conduct at least a examination, or even a mobile sonomammogram or a mammogram unit can be taken there, and camps for those rural population who cannot understand. So a combination of awareness for the urban population and then taking the setup to the rural population with government support and the regional cancer centers, I think this two-pronged approach should give us the maximum benefit.
Right. Dr. Naseer, you spoke about the genomic profiling and how it helps you tailor make a treatment for cancer, because depending on the genes involved, you can then tailor make the treatment, and I'm sure this tailor-made treatment has better effects. Now, would you then suggest that this kind of genomic profiling be done for every cancer sample? Does it work for every kind of cancer?
Yeah, this, like you told, definitely the genomic-based therapy has brought very significant survival in those patients. And yes, now it is the time that we have to do genomic profile in almost all the patients. Like almost all the patients, we have to conduct a genomic profile. We need to know the complete genetic makeup of the individual, and we have to have a complete tumor board meeting, not only involving medical oncologists and other specialties should also be involved, and we have to have a roadmap for the patient. Yes, this is the time now that each patient needs to be completely assessed and completely scanned for the genomic profile. Genomic profile not just gives about the target one mutations also, it also gives about certain biomarkers or certain genes which can tell you that how the patient is going to behave or how the patient is going to respond to the treatment. For example, in case of breast cancer, if the patient is hormone receptor positive, then they tend to do better. And if there is one particular mutation called as P53 mutation, which is commonly seen in most of the cancers, it means that he might not do that well. So the patient, not only the patient, but also the treating individual, treating physician will be aware of it, and he will also convey the same to the patient, so that a complete comprehensive approach for the treatment of the individual has been made. And yes, we need to we have come to a phase that where we have to have a complete genomic profile of the patient, so that we are not only treating for short-term results, we are now looking at very long-term results as well. So to have an answer for the long-term results, it is the time to have a CGP for most of the patients.
Sorry, Dr. Naseer, could you explain what these long-term effects mean? I mean, long-term as in you're trying to prevent a relapse, or
yes,
what
exactly.
is this long?
So the for the treatment of cancer, like consider for the treatment of the breast cancer, if the patient is treated with a conventional treatment with initially chemotherapy followed by surgery, and if we know the genetic makeup and if the patient is hormone receptor positive, so the initial phase brings about the short-term response, and the hormone receptor positivity says that how the patient is going to behave on a long term, and the patient needs to be continued on these drugs and will be having a good response to the therapy. There are certain other types of cancers in breast, like a triple negative, where there is no expression of hormone receptors on the surface. So these individuals might not do well very well on a long-term basis. So all these answers will be known to us if we have a complete genomic profile.
Okay, Dr. Srinivas, in your opinion, is CGP important for precision oncology and its research? And what is this profiling, and how does it compare, or how is it different from the SOC test?
Yeah, so usually the comprehensive genome profiling where we can do in most of the cancers. So lung cancer is the leading example where we can we can give a personalized therapy. We can call it as a precision treatment for that particular patient. So, so lung cancer is the one example where it has moved away the blanket treatment chemotherapy for most of the patients for lung cancer, because the chemotherapy is the last option we keep whenever the lung cancer is diagnosed in the stage 4. So we do the molecular profiling where at least 7 to 8 markers we test. If the chances of them will be around from 50% to 10%. So any one of them is positive, we can postpone the chemotherapy for another 2 years. And we have one more option of immunotherapy where the PD-L1 testing we will do, and if that is positive, further we can postpone the chemotherapy. None of these are positive, then only we go for the chemotherapy. So the blanket treatment where we do once the cancer is diagnosed, let's go for chemotherapy, that has taken away from especially the lung cancer. So definitely, I forgot the next part of the question.
So how is it different from the SOC test?
Yeah, standard of care, that's what I'm telling. The blanket treatment we usually do for most of the patients, the chemotherapy. So that has been taken away because of this genomic profiling most of the cancers, especially the immunotherapy and the molecular testing of this treatment. And even in some of these blood cancers also. So for example, we take an example of chronic myeloid leukemia. So there also immediately we start with biological therapy. And even in case of renal cell carcinoma, so we start with immunotherapy. So this biological therapy and immunotherapy has taken a front seat, and some of the cancers, the chemotherapy we are pushing back to the back seat actually. Definitely it has helped.
Right. Dr. Vishal, Dr. Srinivas has explained to us some of the innovations that are underway. What are you seeing in your practice? How many of these are being, this genomic profiling and targeted medicines? How acceptable and how widespread are these in our country now?
Actually, in the last 2 years, what we have seen is that many Indian companies are coming with these tests, and they have become very cheap. When I started in 2016-15, CGP would cost about 2.5 to 3 lakhs. Now it costs about 50 to 70K, in that range. And there are specific panels, as Dr. Srinivas was telling, for lung cancer. And then there are actually actionable mutations are clubbed together and they make a panel out of it. So these panels come for about 25 to 30K. So most of our patients, we do follow the standard guidelines, testing the targetable mutations and the PD-L1 testing for immunotherapy. And we do, and many of the first generation, second generation targeted therapies have Indian generics already. So it hardly costs some 2,000, 3,000 per month for the patient, especially in lung cancer, to start the treatment. So we can, even in our setting, we usually start with targeted therapies and immunotherapies. We assess everything, and if they're not eligible, we actually ask them to go for chemotherapy. Coming to the immunotherapy, right now the Indian generics are not available, but there are a lot of clinical trials that we as part of HCG group do conduct. In my place, there is a clinical trial for immunotherapy in lung cancer. And then in Bangalore, we have our senior colleagues like Dr. Srinivas sir and Dr. Satish sir. And we usually send the patients if they have a clinical trial for some other cancer. Like a breast cancer, abemaciclib trial is with the Bangalore center. So we usually refer them to that center. So basically, it's like a we have a network, so it becomes easy for us to make sure that we deliver the best possible treatment for our patients with minimal costs. So that's what we usually look at, and we tend to be usually very successful in balancing these cost and benefit. So I think, as Dr. Naseer was saying, CGP will be the future in the next 2 to 3 years. I think we will be slowly shifting towards that, with just further reduction in the cost, and I think it will be accessible to one and all. So that's what I can say.
That's very heartening to hear that at least in the for lung cancer patients after CGP, and profiling and finding the genome or the DNA that is causing the trouble, you can tailor-made affordable treatment plans. Yes. Now, Dr. Sai, we've heard from Dr. Naseer about breast cancer and from Dr. Srinivas and Dr. Vishal about the lung cancer treatments. Now, how can CGP offer both actionable and potentially actionable results to help identify more effective therapeutic paths and innovative clinical trial options for cancer patients of other kinds of cancers as well?
See, basically, CGP is taking a piece of tissue and then going to the DNA level and sequencing the whole of the DNA. So, and then they compare it to a library of a number of people who they consider it to be normal. So if this particular DNA has changes compared to the normal, so those are known as mutations, something away from the normal. So each mutation then goes into extensive research to see whether it is the one causing the cancer or it is just present there, but not harming the particular person it's present in. And once they find it to be something pathogenic or cancer causing, then the research from the drug company sets in, and then you have preclinical trials and different phases of clinical trials, and then it comes to the market as a drug. So with CGP, you identify more of these mutations, and when they will translate into targetable drugs, that is a long process. But the more we sequence, the more we are going to find. So it's all about, we are still, I think, very naive when it comes to knowing everything about the DNA. With time, we shall learn more and probably get a CGP result faster and be able to target much better.
So Dr. Sai, what, for lung cancers and for breast cancer, we are aware of the mutations in the genes. Has enough research been done about the other types of cancers? Where can CGP actually work? All kinds of cancers?
At this point, most of the cancers, after we, especially the rarer cancers, if we run out of options that we already know, like first line of defense, second line of defense, CGP is becoming the third line of defense, or even earlier in most cancers. And it's not long before it starts becoming the first line of defense.
Yeah.
Why treat a person based on just conventional data when you can actually go into the DNA and see what might work best for him? Even logically speaking, that's going to be more effective.
No, that's fine. But for all cancers, do we have treatment modalities where you identify a mutation and then you have a drug that works to block that gene?
So that is the problem. Yeah. That is where we are stuck. So theoretical discussion can happen for us after the results of the CGP come through. When the patient comes with the results of CGP, only around 5 to 10%, that is, if we get CGP for 100 people, hardly 5 to 10% of the results would have drugs which have already been discovered and we can actually use to get a benefit. So at this moment, that's where we are stuck. Common cancers like lung, yes, but the rarer cancers, long way to go in research.
Yeah, but then these common cancers like lung cancer and breast cancer in our country are affecting a very large number of people. And if these newer tests become more affordable, more accessible, a large part of our population is going to benefit from this. Now, I want to understand some of the personal experiences from our cancer warriors. So, Meera ma'am, it was 10 years ago that you got treated initially, and then you in between again. Now, science has moved on, medicines have become better. What was your journey like? Did you have fatigue, side effects? How did you deal with that? And did you have fear? Oh, I'm never going to get out of this. It's going to come back. How did you deal with this, if you had any fear?
Never. I never had fear. I'm a very positive lady. I never think about it, and I request everyone to be like me. 10 years back, I was working in a bank as a manager.
Mhm.
I used to travel by scooter for about 20 to 25 kilometers every day. Maybe that is also a cause. Maybe because of pollution, I might have got this. And the thing is, what I request everyone is not to think about it, and just avoid the people who show sympathy about you. I just keep them away. People who show me sympathy, I just keep them away. I just change the topic. I will never talk to them. I will never talk to them about the cancer. Just change the topic. Talk about food, eating. I am a good eater, good cook. So I just avoid all this, and I request everyone to be like just never should not think about the sickness.
You feel
That
that
is
everybody should treat cancer patients equally and not just think,
cancer.
oh,
Treat
their disease.
treat the cancer as a common like
illness,
flu, like flu,
like a lifestyle disease, like
lifestyle
diabetes.
disease.
Nobody gives
Yes.
sympathy to diabetes patients.
Yeah, of course. Should not show any sympathy. And for me, I didn't face any no shame. In fact, people used to talk to me normally. Most of the people, maybe old people, maybe our mother's side, my sisters and my dad's sister, brothers, they used to, elderly people, they used to show sympathy. Then I used to make them laugh, and I just changed the topic, and I used to come out of that. And that's it. That is my way of, that is my nature, my attitude. And yes,
So
I
that has
keep,
certainly worked for you,
yes,
Meera
of
ma'am.
course.
Now I want to ask
keep
Savita
myself
also.
busy.
Yeah.
I keep myself busy with the yoga, exercise, go for a walk, and I started taking the orders, cooking orders for party orders. I just enjoy my life. That's it. I enjoy
That's
with
great. That's
I
great.
enjoy with my grandkids. That's it.
Savita, Meera ma'am has a very positive disposition, and she coped very well. What was it like for you? Did you have side effects? Did you find on some days that you didn't feel like fighting at all? Did you want to give up? And did you have any support groups? Do they have a role to play in a cancer patient's journey?
Uh, uh, so when I was going through my treatment, yes, those were the days when I was really feeling very low, not because since I was going through the cancer, but because of the side effects of the treatment. Sometimes they were too harsh. And when we are in physical pain, it becomes challenging to be positive all the time. So what I felt is it was okay to cry sometimes. It was okay to feel low sometimes. And what really helped me was getting connected with other patients. Like, for example, if you see Meera ma'am and I had been seeing such other patients, I was like, okay, great. One day I will be on the other side of the tunnel and I would be able to finish my treatment. This is just temporary thing and I can just, move on. Ye din chale jayenge. So those things really helped. But what I would say is it's okay. Sometimes we are depressed. Sometimes we are the treatment is not so easy, and everybody responds in different manner. So some days were good and some days were really bad. So but yeah, we have to keep going and connecting to other patient and getting inspired from them and getting motivated. What was the main thing which kept me going apart from the family support?
Definitely. Everybody's experience is their own, it's unique. And the best part is that you're open about discussing this with everybody here. And, this transparency will help remove the fear in the minds of people that, cancer is a death sentence. It's seen now as a chronic disease. And if caught early, has a very good prognosis. We are seeing two cancer warriors with us. So, and we have spoken to many more. So the key is to be more aware and, to be more proactive yourself and for the medical community as well. Dr. Naseer, while CGP is this new horizon which will really help improve treatment of cancer patients, I'm just trying to understand what are the challenges that are there in our country for comprehensive genomic profiling.
Yeah, for CGP, it comes at a cost. That's the most important.
Which is coming down, right?
Yeah,
and we've seen that with other cancer treatment medicines also. Generics come and it comes down. Other than the cost, are there other challenges?
Sometimes in CGP, not many other challenges are there, but sometimes in CGP we find some mutations called as variant of unknown significance. The significance of that particular mutation is not exactly known. There's a lot of study literature trials going on to find out what exactly that mutation is, and is there any targetable drug available for that or not. There is one thing which can come in treating clinicians path. But there are solutions for that also. You can do a repeat CGP and you can follow up the patient very closely. So it all depends on the clinical profile. So other than cost, which is also coming down, I don't see any significant
challenge. Okay, that's very heartening that we have a new age technology that could be taken up at scale in our country, with the cost also coming down, and with greater benefits as far as treatment is concerned. So we're coming to the close of this show, and I thank each one of you for joining us. I would like to take one closing line from each one of you that you would like to say to the audience. And I'd start with Dr. Roshni. Ma'am, what's that one thing you want to tell the audience on catching cancer early?
I think the best thing about today's session were that we had cancer warriors with us. So coming from the people who have gone through this, who are going through it and having a good quality of life. So my one message would be, don't fear cancer. Don't fear the diagnosis of it. Be aware, take the treatment. You might just be you might just have a normal life, even with ongoing treatment. So yes, that would be one closing line, not to fear cancer.
Dr. Srinivas, what would you like to say? Your one last line for everybody watching.
Yeah, educate yourself regarding the cancer. Educating one person will be educating of the whole family for the cancer, regarding the cancer awareness and early detection. So I advise all of the audience who are watching to educate themselves, awareness themselves about the cancer.
Great. Dr. Vishal, other than awareness, sometimes it becomes like a double-edged sword. Google is your doctor and you get a lot of misinformation too. So what do? Awareness is important, the source is important, plus knowing about the latest in technology is also going to help you, rather than go down the rabbit hole, you'll find your own way. So what is the best way forward for more awareness and also for newer research that may be underway that we perhaps in our country can do for our country?
Basically, I think awareness is definitely a key. And also, I think if a patient or general public does a doctor Google search, and then I think they should confirm with the actual doctors whether the information is true or not. I think that helps clear a lot of doubts, a lot of misinformation. And the last thing, what I say is the infectiousness of the I'm just going off topic a bit, but I couldn't help but saying that Mrs. Meera's positiveness is very infectious. And I think there is some research in epigenetics which says that if you have a good epigenetic profile, your bad genes can be regulated. So it's like a bad gene is like a switched on fan, and epigenetics is like a regulator. So happy people, positive people tend to have better epigenetic profile is what they say. And I think Mrs. Meera is an example of that. So I think we should, even if we are faced with these deadly diseases, we should not let ourselves down and be happy and take one day as it comes and live life positively. That's what I can say. Thank you.
I think we should have another full session on epigenetics because we have on our show previously also many positive cancer patients, and that really completely changes the narrative. Dr. Saib, what would you like to say as your last line in this show?
I think I would like to keep it short. I would say education and empathy and early availability of the precision medicine, I think, is the way to go in the future.
Okay. Dr. Naseer, what would you like to say for people who fear new age medicine or new age, new things? Some people like tried and tested old things. What would you like to say?
I would like to say that the most important aspect here is positive attitude. Whether it's a bad news or good news, positive attitude is the most important aspect. Now you can come across almost all the barriers, whatever it is. So that is the one thing which I would tell, and it's a living example is Meera ma'am. So nothing other than that, nothing else. Yeah, positive attitude.
So, Meera ma'am, what would you say? I know keeping a smile on makes it easier, or puts the cancer down. How can people do that if they're feeling dejected or they are in pain? Because people have different experiences. What would you say to them?
Yeah, just be positive. Just throw away the fear and enjoy your life. That's the life.
Okay, that's the mantra to beat cancer. Savita, your last word. What would you like to say to all those watching about your cancer journey and what people can do to be self-aware?
So my message would be that awareness is really going to help, and don't shy away asking right questions to your doctors. I mean, and there is no harm in going for second opinion. It can save your life, and only you can be advocate of your health. So don't shy away, go for second opinion, ask right question to the doctors. And yes, as Meera ma'am said, just be happy and follow your passion, reprioritize things, and just, I think I feel I'm enjoying my life much more than ever before after cancer.
Yeah, I think because everybody realizes that life is a gift
Yes.
to be enjoyed. And the second life is one that they make the most of. Thank you so much for joining us, Dr. Sai, Dr. Naseer, Dr. Srinivas, Dr. Vishal, Savita, Dr. Roshni, Meera ma'am. Thank you all for joining us today and sharing with us your experiences, your knowledge, your wisdom. We hope that cancer is a disease which is caught early on in our country. The stigma and the fear from cancer is removed as more and more of us talk about this. And we have new age technologies that help with better prognosis for those undergoing treatment in our country. Thank you all for joining us.
In village or metro, in shanty or town, people cry, is cancer a curse? Punished by past life? No, my friend, no one's cursed you. It's not your fate to. Be not afraid, panic not. Cancer is not a curse. Things could be worse. It comes to the rich, it comes to the poor, it comes to a child or a person old. But those that have had it have shown how to fight it. With grit and will have shown how to beat it. Warriors all are back at work. Warriors are back with their family. Remember, patients need love and need to be told how to be bold. Make them strong. Show that you care. Good thoughts you share. Did you know you won't get it by touch? It's not contagious as such. It's not passed to the family or the neighborhood kids. So, be not afraid, panic not. Cancer is not a curse.